This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And good morning, and thanks so much for joining us today on the program. We're going to talk about something very important. June is World Elder Abuse Awareness Month. That's World Elder Abuse Awareness Month. And national studies show as many as 1 in 10 seniors is a victim of elder abuse. Now, last year, Ohio made more than 38,000 referrals for elder abuse. On the program with us today is the director of the Franklin County Office on Aging, Chanda Wingo, and also Caroline Rankin is here, the assistant director of the Franklin County Office on Aging. And thanks so much for being here, both of you.
Thank you for having us.
Director Wingo, tell us a little bit about what is elder abuse in your definition.
Thank you. So for the Franklin County Office on Aging, we are a levy-funded agency, and most of our programs begin at the age of 60. So our focus is on older adults who are 60 and older, and that would include anyone that is being exposed to any type of abuse, whether it is neglect, self-neglect, abandonment, exploitation of their resources, whether it's their home or actual income.
Mm-hmm. So this can be by a caregiver or by someone outside the home as well?
Most commonly, it's by a caregiver or a family member, someone who has direct access and is responsible for the care of the older adult, whether it's the day-to-day needs or if they were assigned to be responsible for the financial pieces and ensuring that those things, that direct access is what makes it easy for them to do so.
And Caroline, are the instances or the reports of elder abuse going up?
They are, but there are several factors to consider. One, we're an aging society. Ohio is an aging state. So as the numbers go up, we would expect to see, an increase in referrals. We've also, over the last really 3 to 4 years, really worked hard to increase awareness and education on elder abuse, what elder abuse is, how to report it, and the importance of reporting it, because we want to provide assistance. We want to provide help. We want to create that safety plan. So with that education, we have seen an increase in referrals, yes.
And so I guess, are the instances going up, or is it just better reporting?
I would say really it's a combination. It's a combination of both. It's better reporting. We have more mandated reporters who have to report. And then again, as you increase awareness and you make more individuals aware, we always say, go ahead, if you suspect something, report it. We can then investigate it and get services and a safety plan in place for that adult.
If I could add, during the pandemic, the stay-at-home orders, there was a significant decline in referrals. And so that is also another contributing factor now that we're back to a new normal. That's also one component I wanted to make sure we added.
What are some of the warning signs that people should be looking for?
I would say any change in behavior. If you notice that an older adult has become withdrawn, physical pieces such as bruises, cuts, scrapes, any of those types of things that, they're questionable, there's a good indication there, especially if they're very private and don't want you, asking questions or coming to their home, have just really become different.
Mm-hmm. What are some of the resources available if somebody thinks that, an elder is being abused? Who should they contact first?
Well, there are several options. I mean, you can call the police, as always, depending on the severity. We want to make sure that, everybody is safe. So I would recommend the police first. If not, and you're just not quite sure and you want more information, you can definitely give us a call. In the Office on Aging, we also have Adult Protective Services, which is directly under Caroline Rankin. There's also a state hotline, and we'll provide those numbers here momentarily, but there is a state hotline as well where you can report elder abuse. And I'll let Caroline go from there.
Yeah. So when the report comes in, it's getting information. Everything is confidential. Someone who makes the report, it will never be disclosed who that is. Oftentimes, people are very afraid to report. We are mandated by law to investigate and investigate quickly. So when that initial referral comes in, a decision on it must be made within 24 hours, either to screen it in or screen it out. And then the investigation must happen or be initiated within the next 72 hours. So there's a very short time frame from when a referral comes in to when our case managers are seeing folks face to face, to then get eyes on folks to see what the situation is. And then within 30 days, we must have an investigation completed. So it's a quick process, because we know it's very important to see people quickly and get the process going.
How many investigators do you have?
So when fully staffed, we have 15 investigators, we have 2 supervisors, and we have an administrator over the department. We also have 2 staff that take the referrals, and that's, they take those calls that come in. We are open every day from 9 to 5, but then at a statewide, we have a call center, a call line where you can call 24/7 and you can make that report. Also, you can go online to make a report at any time.
And if you confirm an instance of abuse, what happens next?
So with abuse, so let's say an example is self-neglect, where the adult is really struggling to care for their own needs. For that kind of a situation, most or really all older adults want to stay in their home, and we want to help them do that for as long as they can. If the allegations are true, again, we're going to work with that older adult to put a plan in place so that they can stay successful in their home and have the support they need. So an example of that could be we get a referral from a doctor's office because somebody's not making their doctor's appointments. Well, they tell us, I'm not driving anymore. Well, then we can set up transportation and get them. And so to alleviate that. So oftentimes it's going into the situation, seeing what the issues are, and then getting services in place in order to support them.
What if it's not self-neglect? What if it's somebody else?
So in situations, as the director talked about with financial exploitation, we worked with the banks often. We will quickly work to get, accounts shut down because we want that exploitation to stop. We also do a lot of education. The other key piece is who can we get in place to support that older adult? If that adult family members may not even be aware of what's going on. And so if we are able to get a trusted family member in place who can support us with that plan to make sure as we put plans in place, they don't unravel when we step away. Because again, the work of Adult Protective Services is short term. And so when we step away, we need to make sure things are in place that adult stays safe.
We're talking about Elder Abuse Awareness Month. It is in June, and with us are a couple of experts from here in Franklin County. The director, Chanda Wingo, who is and the assistant director, Carolyn Rankin, from the Franklin County Office on Aging. And Director Wingo, it sounds like this isn't something that your agency does alone. You also work very well with the other agencies here in Franklin County, law enforcement and others.
Mm-hmm, that's correct. So for clarification, Adult Protective Services is a federal program. It is governed very heavily with Ohio Revised Code, Ohio Administrative Code, and those rules must be adhered to whenever we're coming in. Internally, we offer programs that support Adult Protective Services. So whenever the team goes in and they identify, examples such as, Caroline mentioned, whether it's transportation, we also offer free meals because as we know, when adults age in place, day-to-day tasks become, more cumbersome. So free meals is probably one of the most popular options that we provide, but that is through our Senior Options program. Again, we are a levy-funded agency, so I wanted to say thank you to everyone who voted yes for that, because without, those levy dollars, we wouldn't be able to provide these services. We also work with other Franklin County agencies, such as Franklin County Job and Family Services, to ensure, Medicaid is in place, and ensure that, whatever resources, they also provide transportation through Medicaid as well. We also work very closely with the Attorney General. We work very closely with probate court and the guardianship board. We also work very closely with Legal Aid Society, and Caroline mentioned a new one, Pro Senior, which provide legal advice and legal services to, in some instances, to a low to no cost, depending on the situation. We also work with some housing vendors, in the event that the solution is that the senior needs to be put into a new home. We also work very closely with courts when we are able to secure protection orders in the event that we need that senior to remain either in the hospital or in a safe location while we work to ensure that there is a complete safety plan in place. I think I've mentioned a good number of them. Did I miss any, Caroline?
You mentioned a lot. No, thank you. You did a great job. Again, most often our seniors, it's about getting a plan in place. And so having those community partners is critically important.
It's interesting. There are resources available, and a lot of times people just don't know about them, and that can be frustrating, I'm sure.
That's the big thing that we found. Our administration is fairly new. Caroline has been in her position the longest. The rest of us is about a 2-year mark. And what we found is that the community did not know that the Franklin County Office on Aging existed. They knew about adult protective services, and they knew about senior options, and they know about our sister agency, the Central Ohio Area on Aging. And we're like, hey, no, we're the Franklin County Office on Aging. We have all of these services. And so, we've been very intentional with conducting surveys and community needs assessments and increasing our social media presence. And we've established a newsletter. We've even ramped up our outreach from doing about 29 events a year to last year, well over 400. We're in places that seniors and their families are. So you're going to find us at school fairs. You're going to find us at the libraries. You're going to find us in the hospitals. You're going to find us everywhere because there's somebody aging. And as I mentioned earlier before we started on the show, and Caroline mentioned that, our aging population is the fastest growing population. If you read anything today, they're going to tell you that by 2030, there's going to be more seniors than there will be kindergartners. And so we have a lot of work to do to increase that awareness because to your point, there's so many things that impact the lives of seniors and their family members, and these resources are out here. We want to make sure that at the very least, those folks know that we're here, and even if we don't have the answer, we have a lot of relationships and are able to make referrals to the right places to make sure that our seniors are able to age in place safely and successfully.
Well, nobody wants to go to a nursing home. And for society in general, it's better to keep people in their homes as long as you possibly can. So you have actual programs that can help people do that.
That's our entire mission for the Franklin County Office on Aging, is to provide both home and community-based support to allow our seniors to age in place. We also realize that, and one of the things I say all the time, and I know I sound like a broken record because I want people to understand, that aging is more multi-generational now than ever before. If you go to an elementary school at the beginning of the day, it's grandparents that are dropping children off. We also have in our caseloads, we have older adults raising young people through whatever the issue may be. They have custody or they're taking care of these young folks. And so when we are out and we're thinking about how to get this information out, we're like, well, 9 times out of 10, older adults are going to listen to their trusted people, their family and their friends. And so if we can make sure that they're aware that we're here, they're aware of our resources, if nothing else, just our phone number, we're successful in ensuring that message is out there.
I'm glad you said that. Tell us the phone number if people can call to get more information from the Franklin County Office on Aging.
So the Franklin County Office on Aging, the phone number is 614-525-6200. And for Adult Protective Services, the phone number is 614-525-4348.
And do you have a website as well?
Mm-hmm. It is theofficeonaging.org.
Wow, that's easy to remember. That's a good one, because many times a lot of the government agencies have a lot of dots in this, at Ohio's and Franklin counties. So that's an easy one to remember for sure. Our guests on the program today are Chanda Wingo, who is the director of the Franklin County Office on Aging, and the assistant director, Caroline Rankin, is also with us today. Caroline, you talked about the protective services, adult protective services, and you were telling me before we went on the program, it's not like children's services where you can go in and take someone out of a home. It's different.
Right. Adults have the right to make their own decisions. If an adult has capacity, they can make decisions. We may not agree with them. They may not be the best decisions, but they have the right to do that. So as we go in and investigate cases, again, we have to look at what the situation is. We can offer services. An adult doesn't have to accept them if they don't want to. Most often, adults will. Most often, they will do that. When an adult does not have capacity, that is where we work very closely with probate court. We will work with family, because that's critically important. We have a plan in place, and they have a plan to ensure that adult is safe, because when adult doesn't have the capacity to make decisions, that's when exploitation can really occur, and abuse. So again, as we do education and awareness, making folks aware of what a power of attorney means. When someone has capacity, somebody else does not have power of attorney over them. It's only when that person cannot make decisions, and oftentimes people are very confused about that. But when it is deemed that that adult does not have capacity, and that can only be done by a physician, then we are working to say, okay, what has to get put in place? Is it a guardian? Can that be a family member? Or is it the Guardianship Services Board, which is here in Franklin County, which is a board that is in place to provide guardians for that older adult to stay safe. And currently, we have 80 individuals being cared for through the Guardianship Services Board, with referrals going back to 2016 to them, so that they continue to provide guardianship for that older adult. But folks need to understand, we come in, we look at the situation, we're there to help you. We're there as a resource. As the director shared, we want older adults to stay in their home. We know that's where they want to be, but we need to make sure they're safe. And so working with them to create a plan, hearing back from them what they want. So often older adults, one, are very proud, don't want to accept help, but also for older adults, they see so many things being taken away from them and options, and they're often afraid. Well, if somebody knows I'm having this struggle, will my family take this option away? Or will they say, see, you can no longer live on your own? And so we really want to work with them to meet their care needs and what they want.
What about if someone is already in an assisted living situation and someone suspects abuse there? Do you have any authority there to investigate?
That is a great question, and no, we don't. By law, we can only investigate in a community setting, so either in a home or an independent. For someone who is in an assisted living, a nursing home, that is through the state, and there are two avenues there. You can go to the Ohio Department of Health, which is they license facilities, and if you just go to their website and you say nursing home complaint, it takes you directly to a very easy form to complete, and they must investigate every complaint that comes in. And then at the office, the Ohio Department of Aging, they have the Ombudsman program, and you can also contact them.
And not to get everybody confused with phone numbers and websites, but I do want to mention that the state has an elder abuse hotline, which is 855-644-6277, and a website, agesafelyohio.org. So let's go ahead and get those out there as well. Just more resources, I guess. Director Wingo, tell us about your agency and as you look at everything you do overall, what's your biggest need right now?
That's a loaded question. One of the things that I tell and I say often is that there's not ever going to be enough money, enough resources, and enough workforce. So I think the number one need, honestly, is we need the community to step up and step in and become caregivers, whether you are in the home or in the community. It's simple. I mean, you can come together and somebody can make sure that the trash is taken out. Someone else can make sure that the grass is cut. A family member can come in and make sure that medicine is taken and that food is being consumed. But I think that is what my call to action is I need everyone that is capable, willing and capable to step up and help provide care for our older adults. And it isn't always about meeting, those immediate needs, but it's sometimes helping us combat social isolation. Mm-hmm. We just learned last week that social isolation is the equivalent to smoking 15 cigarettes a day. And if you think about that reduces life expectancy by 7 years.
Wow.
And so even if it's just as simple as picking up the phone and calling and having a conversation, this is a community effort. And we're here to help educate and advocate, but we really need the community to get involved and make sure that our seniors are okay.
And as part of everything that your agency does is there any sort of health care involved, like a home nursing or anything like that?
So through several of our programs, we do offer some light services, whether it be adult daycare, which typically is respite for our caregivers. We also have, through Senior Options, some light cleaning where individuals can come in and make sure that the house is, maintained and clean. There is also a service where we provide light grooming. So someone will come in and help, take care of your day-to-day personal needs. And then I believe through Caregiver, there's some similar programs as well.
Yeah, so our Caregiver program is specifically for the caregiver. And we're lucky enough to have a grant for that. And one of the most requested is it's respite, but it's respite at a assisted living facility. So we work with 3 different facilities, one which has a focus on memory care. Because if you're a caregiver and you want to take a vacation, oftentimes you can't because you have nobody to care for your loved one. And this respite allows that adult to go on vacation or take a much needed break. And that adult can be in a facility for between 6 to 10 days. It's not immediate, so we can't do emergency where somebody says, hey, I got to go out of town next week. I need my mother who I'm caring for in this. It takes about 30 days because there's a lot that has to get done as far as medication. They do a home visit. We have to make sure it's a right fit. But that has really been key for our families and our caregivers because it allows them to get that vacation or take that break that they need as a caregiver, and then they know their loved one is being cared for in a facility.
Caroline, will you share this story?
Yeah, so we had a great story of I had a caregiver. She was in her 70s taking care of her 97-year-old mother, and she contacted me, our caregiver program, and she was going to she wanted to go see her daughter. Her daughter was getting her master's, and she wanted to go see that, and she needed the respite. We call it institutional respite. And so she got set up. Everything went well. She went on the trip. Well, after the trip, I got a call from the granddaughter. And she said, I can't thank you enough. She said, it meant the world to me that my mother was here to see me get my master's, but also my mother knew my grandmother was being taken care of. And so, they really, really appreciated it. And as you think, when you're caring for an older adult, so many people don't have a family member who can come and stay. Mm-hmm. And that caregiver is doing so much on their own. And so our caregiver program can provide that assistance.
Are your services need-based, or is there any qualification for getting the services, or do you just have to be an older person in Franklin County?
So if I could just take a moment and, we're throwing a lot of names of our programs out, but we haven't covered them all, right?
Sure, yeah.
So obviously we mentioned Adult Protective Services is in our office. There's no income guideline for that. Again, your basic eligibility is 60, you live in Franklin County. Our second program, which is Senior Options, and that is the program, again, it's 60 is the minimum age and live in Franklin County. That program does have a sliding fee scale component, which looks at both your income and resources. Mm-hmm. It's important that we allow our older adults and their families to maintain, I believe it's $10,000 in resources, which is allocated typically for burial plans. But if your income is less than $1,640 a month, you'll have a zero copay. Anything above that, you could fall anywhere between 5 and 100% copay. We also have Caregiver, which we mentioned by name, but Caregiver focuses on the needs of the caregiver themselves. What we learned also in the work that we do with caregivers, oftentimes you're a caregiver, but you don't identify yourself as such. It's a birthright. My mom needs me to take care of her. You step right in. And you sacrifice your own needs and your own financial resources. And so that program makes sure that our caregivers are whole as best as possible so that they can continue to ensure care. So that could be counseling, or that could be where we come in and provide durable medical equipment or nutritionals or incontinence supplies. And then our last program, our next program is Kinship, similar to Caregiver. But this program focuses on our older adults who are taking care of non-biological children. Oftentimes, this is a grandchild, great-grandchild, niece, some type of family member, or even family friends in some instances. But we also know that older adults, when they take young people in, they may not be in the best financial situation, or their home may not have been conducive for young people. So this program will purchase beds and mattresses, will help pay for items such as clothes, after school care, summer camps, any of those things that older adults typically wouldn't be able to afford, being on a fixed income to provide services for those children. Our last program, which also kind of looks at resources, is minor home repair. Mm-hmm. And minor home repair is not a renovation program. This program is intended to provide any updates or changes to allow our older adults to remain in their home safely. So sometimes that is the installation of a ramp, a wheelchair ramp, or an installation of grab bars so that you can enter in and out of the home or in and out of the shower. They may also come in and do some HVAC, if the heat isn't working or if the cooling isn't working, electrical, any of those things that you can think of that are costly, that are not allowing the home to be safe. Our minor home repair program will come in and provide those services.
We've talked about a lot of programs today that I'm sure a lot of people didn't know were available, and I had about 1 million more questions, but we're out of time. So I guess you're just going to have to come back on the program.
We would be happy to do that.
Yeah, we started talking off about June being World Elder Abuse Awareness Month, and our guests on the program today have been the director of the Franklin County Office on Aging, Chanda Wingo, and also the assistant director, Caroline Rankin. So thank you both for being here. And one more time, could you give us the phone numbers if people want to contact your office?
Our main line is 614-525-6200, and the APS line is 614-525-4348.
And your website again?
officeonaging.org.
Well, I want to thank you both for being here today. And like I said, the door is always open if you'd like to come back and give us more really good information about taking care of our elderly citizens in Franklin County. Thank you.
Thanks for having us.
Thank you.
Thanks for listening to Columbus Concerns. a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.